Dear colleagues, distinguished representatives of the European Commission and UNICEF, ladies and gentlemen, I would like to begin by acknowledging the very valuable support of UNICEF. Your technical assistance has been critical for Greece in turning the European Child Guarantee from a framework into action. Over the past years, we have made a deliberate shift in how we protect children. We moved away from a system that relied heavily on institutions to one that prioritizes family-based care, community services, and prevention. And this shift is measurable. Since 2019, Greece has reduced by 50% the number of children living in institutional care. For the first time, we have now a clear national picture of children living in institutional care. We know exactly how many children are in each institution, and for each child, there is an individual family restoration plan that guides the next step of their care. At the same time, we have strengthened alternative care. We expanded foster care and introduced professional foster care, particularly for children with disabilities or complex needs, who require more stable and specialized support. We're also supporting young people as they are in transition out of care. Through supported semi-independent living apartments, young people aged 15 to 26 live in supervised apartments with daily support and guidance towards education and employment opportunities. But real change starts earlier, at prevention. We have introduced early intervention programs for children aged 0 to 6, supporting both the child and the family from the very beginning so that separation can be prevented before it becomes necessary. In practice, this means building a system around the child, not around institutions. And this is exactly where our national efforts connect with the European Child Guarantee. In fact, they align completely. We are working across its core priorities: access to early childhood care, education, healthcare, nutrition, and decent living conditions. Because vulnerability is never only single-dimensional. This is why we also address child poverty directly. Today in Greece, 1 in 2 primary school students receives a free, warm school meal. This ensures daily access to proper nutrition, supports families under pressure, and promotes healthier habits from an early stage, contributing to the prevention of childhood obesity. What we're learning is simple. No single policy can address child poverty or exclusion on its own. Real impact comes when services, income support, and family policies work together around each child. For Greece, the priority is clear: fewer children in institutions, more children growing up in families, and every vulnerable child with real access to social services. In the end, progress is measured by something very concrete: whether each and every child has a fair chance to move forward. Thank you very much for your contribution, the discussion, and the collaboration.